I'm Deb Packwood, I'm the Operations Director for Pathology First. We operate the pathology services for 2 local hospitals. We take blood samples and process them in our modern building here. In the laboratory, the type of processes we can do with the new hub and spoke model is to put high levels of automation. So we have the most modern, longest track in this part of the world, which allows tubes to go around in a circle in and out of all of the different analysers, performing the tests that are requested from our data entry screens.
My name is Sadip Channa. I'm Technical Director for CSI and I look after the Managed Services business. So my team is responsible for architecting any managed services solutions and data centre designs. So Coleshill is a manned 24/7 secure site where we provide SOC services to many of our managed service customers. We have retina scanners, secure ID access, so a very secure site which works very well for our customers. So I've been working for the NHS on and off for about 20 years. I originally started working directly for the NHS and then I moved out supplying services and projects back into the NHS. So originally the brief was to look at the architecture and help IPP design what their platform would look like. It was an interesting challenge because this is a multi-tenanted platform and both IPP and the software vendors that were working together hadn't designed this kind of platform before. So it was a very new scenario for everyone. So the main application was provided by Clinisys, who I've worked with for several years, even pre-IPP. So we had a very early on engagement with Clinisys. Beckman were there and so were BD. So there were several partners we had to work with very closely to get a solution that worked across all parts of the business.
My name is Charles Lilly. I'm the IT Director of SynLab UK, which includes IPP, Pathology First, the pathology laboratory here in Essex. IPP is a subsidiary of SynLab UK. SynLab is part of a European-wide business with a €1.5 billion turnover that operates in 35 countries in 5 continents, providing pathology services in all of those countries. Resilience is really important as well as availability. Our service operates 7 days a week, 365 days a year and has to be available. As a consequence, we tend to double everything up so that we have dual switches, dual lines, we have high availability servers so that in the event of any failure, we can immediately switch to an alternative.
Going to the cloud offers lots of mobility. No longer does the clinician have to be at a point with a PC. He can be mobile at the patient side or where he needs to be. Cybersecurity has an effect on everyone's business. It is paramount. Clearly recent events have showed and highlighted that. Although we didn't get affected here, I have worked with various trusts that did, and the effect on them was catastrophic and on the patients.
We do more about security than normal. So we use products, the latest industry strength products, to ensure that we can combat things like the most recent attacks, WannaCry and its successor on the NHS. We were not affected by those viruses. We want to use more advanced technology. SynLab is developing centres of expertise in each of the countries. There are significant opportunities, artificial intelligence, the use of simplifying some of the production techniques, the use of big data. We have volumes of data about large quantities of examinations and tests that have been done. We need to exploit the use of that.
The benefits we have is to have a cloud solution, which means open architecture. That means we can scale out to the needs of the business. Our Citrix solution means they can access this from anywhere.
I'm extremely passionate about the quality of the results going out in order to get the best patient care that we can provide.
We want to improve the care of patients by making diagnostic techniques more available to clinicians when they're looking after patients, and to do that faster and cheaper than anybody else. There are significant financial benefits to a trust in using this model of pathology. They will save millions of pounds.